Wake up, Zambia.
Good morning. Good morning.
A brand new morning experience is coming your way. Introducing the Power Breakfast, where the queens of breakfast serve up the hottest conversations, freshest hits, and everything you need to start your day right. Catch the Queens of Breakfast every weekday from 6 a.m. to 10 a.m. on Power FM and Dstv. And no, this isn't an April Fool's joke. It all begins April 1st. Power up your mornings with the Power Breakfast.
Power Breakfast.
Radio phone-in show that gives listeners a platform to voice their opinions on current affairs, social issues, and community concerns. With engaging discussions, expert insights, real-time audience participation. Voice of the people.
A very good morning to you. My name is Patrick Chifombo. Joining the Queens of Breakfast this morning, the Residents Doctors Association of Zambia, RDAZ, announced that all volunteer resident doctors will withdraw their services from public hospitals starting yesterday. This action responds to ongoing issues of unpaid medical labor, with over 50% of public hospitals relying on unemployed resident doctors to provide essential services without compensation. RDAZ is therefore demanding for fair working conditions and urgent engagement from authorities to resolve this critical issue. Joining us today on Voice of the People to shed more light on this situation is Dr. Paul Chibwe, who is the president of the Resident Doctors Association of Zambia. A very good morning to you, Dr. Chibwe. How are you today?
Good morning, Patrick. I'm fine, thank you. How are you?
First things first, tell us exactly, what does the Resident Doctors Association of Zambia do?
Well, we're the voice of the resident doctors, and these are specialized doctors all the way down to medical students. So we simply uphold the welfare of the doctors and with the mandate to speak on health care in the country. Yes.
And is that strictly for resident doctors or practicing doctors as well?
Well, so what we mean by resident doctors, you have it's just apart from the specialized doctors.
Okay.
Yes, everyone else going down to medical students, yes. So you have doctors who are after school, they're practicing, doctors that go postgraduate, but before they specialize. Those are under resident doctors, yes.
Therefore, you do not have volunteer doctors?
No, we have. So now we have categories of membership.
Okay.
We have ordinary members who pay subscription, then we have associate members. Mm-hmm. So now these are members who are in training, both local and international, and then you have doctors that are not paying subscription. These fall under associate members. And then we have ordinary membership. So we have three categories of membership. So unemployed doctors are our members as well.
Okay.
The associate, yes.
Maybe let's just get into the gist of the matter.
Yes.
What is the impasse? What is the big deal?
Well, we feel doctors have been taken for granted, really, because the gap is not being filled. When you talk of stats, we say the ratio now is one doctor to 12,000 patients, and that's below what's expected under WHO, which is one doctor to 5,000 patients. But if you look at the actual stats now, we fall below even the one that is acceptable under the countries like Zambia, because now this gap is being covered by volunteer doctors. So when we get to these tables where we want to negotiate an employment of doctors, there's a bit of comfort from their stakeholders, because the impact is not being felt. We don't have patients who are going to complain to the ministry to say we were at the facility all day and no one, we didn't get enough doctors to see us. Yes. And we thought this would have continued business as usual, because there's no gap that is being felt in the facilities. Yes.
But just listening to some of the recent pronouncements by the authorities, in particular the minister, you would think that the recruitment of more doctors was planned for, was budgeted for. What seems to be the issue there?
Well, you see, if we have enough doctors in these facilities, then why are doctors being threatened to go back? Right now, when you go on Facebook, you find that people now coming up. The recent nurse who got employed because she volunteered for 4 years is on record testifying how volunteering is a good thing. So we have now this part of senior management officers calling doctors to come back, saying if you don't come back, you never come back to facilities. If you don't report today, you won't sign your logbooks. And most of these doctors, apart from the passion to champion healthcare, they started this free internship to just get a full registration. So you move with your logbook, where you document what you do, procedures and whatnot, hoping at the end of the day they sign you out and you get a full registration and go wherever you want to go, be it outside the country or just a private sector. So now, if you are told if you don't come back, we won't sign your logbook, and you've worked for 9 months, how is that going to help? And we mentioned to say, if you think we have enough doctors in the facility, then let us go and we'll go. Then why are they threatening people to go back if we have enough doctors in these facilities?
The health minister did put out a statement saying that, and he did remind that the health workers that are volunteering, it's not a mandatory pathway to employment. What's your take on that?
I've been on record saying, as an association, we don't support that criteria. It's not a criteria. And we're not calling for these doctors to be paid for what they've worked for on the voluntary basis. No. We're saying we're tired of volunteering with no roadmap. It's like we're giving services for free indefinitely. Like, we want to have a clear roadmap on when these doctors are going to be employed and the number of doctors being employed. Because some of these guys, we have doctors who've been volunteering for 4 years. So now, people would comment on, no, you get a full registration, but how many private facilities are able to employ a doctor full-time who's a senior officer and being paid full-time? How many are able to do that? Very few. You see, we had pronouncements of some of these private facilities to take up our junior residents. Most of them can't afford to absorb junior, what more the senior ones. Hence, we have still doctors who have attained full registration and still on the streets. Meaning, whether you do free internship or not, you still don't have employment. Meaning there's no basis of volunteering. We're doing this just to help. But then we need government to be bothered. We don't want them to feel this is the normal now. And that's why we're stepping out and saying we're pulling out. It is a choice, yes, and that's why I want to be, let them allow our doctors to pull out by choice as well. But now, we came by choice, yet there's a lot of resistance. All of a sudden, just yesterday, there's SMSs, superintendents calling the doctors to come back, and then you have to submit a letter of withdrawal and all sorts of things. And then if you follow the statement from Minister, now he's saying government is going to prioritize volunteers. On the other hand, he's saying you can leave. That's blackmail. No, that's blackmail, because now doctors would be scared to say if government is going to prioritize volunteering, meaning we have to volunteer. And the difference, you mentioned something, to give an example of Hero Stadium. That was a different case. You see, the minister then, Sylvia Marcel, called the associations to deploy doctors to Hero Stadium because of the outbreak. Because this was to avoid clipping the system in these facilities. And from the get-go, there was a request for these doctors to go with contracts. It was a show of commitment to say once these doctors go to Hero Stadium, they'll be transitioned to permanent employment. We had about 95 doctors who volunteered, and they got employed. It's a different case. That was a commitment. We want a similar commitment now. We're not saying they need to be paid for volunteer, and that's the misconception from the public. And now you like yesterday, you have papers, media calling me to say what's the outcome of the meeting that you had. So the minister goes public to say the government is seeking to meet RGZ, yet he goes 22 hours, he posts a statement that is making seem doctors are self-entitled. You say, but is it fair that because doctors are not happy with how things are going for them, we step forward, we should be self-entitled.
Dr. Chibwe, from what I'm gathering, it seems there's a lot of misconceptions. There is no proper roadmap. How is it that you are not talking to the government as Resident Doctors Association? How is it that there is no clear strategy on how doctors will be absorbed into the system? What is the big deal, again, I ask?
There's a lack of engagement.
Okay, why so?
You see, because when we write letters to invite ourselves, minister's office, we don't get a green light. There's no proper engagement. If we've had all these engagements, they would have had something to point at. So we are this and this and this. You see, with the announcement was made on Friday, and we gave more time. The issue wasn't that we wanted to go through with this. There was enough time for Ministry to respond. But the first thing is the Minister responded on social media on Sunday, which is very unusual. After that, we will go a few days again. Tomorrow it comes out 22 hours in the night and still respond. But all this time, why is it not engaging us? So that we sit. We wouldn't have gone through with all this if we had that engagement. If he's not talking to us, how are we going to talk to them? We're going to talk through the media. Maybe that's one thing that is important to him. And one thing for me, the emphasis that I should echo is to the rest of the health workers. You see, like when this is a movement of divide and conquer, so you have now nurses and other cadres rising up. We don't represent you. If you're happy with what you're going through, then be happy. We have your own associations, you have your own presidents. If they're not rising up to speak, I'm not going to do that. My executive is not going to do that. The best thing that you can do is, if you don't buy into what we're doing, you keep quiet or offer solidarity, because tomorrow you're going to have an issue and you're going to come out, and you wouldn't want RDZ to step out and say you're self-entitled or you don't deserve to voice out your issues. The best you can do is offer solidarity, because this is our issue, and if you're okay with volunteering, then go ahead. We did make a pronouncement to include other cadres. No, we spoke because we have the mandate to speak for the doctors. We're not saying this is also poor, no. See, and that's the thing, yeah.
Let's talk about the unpaid labor. I think I've seen some posts on social media where they're saying that the impact is now being felt by the doctors who have stopped since yesterday, effective yesterday. So now let's talk about the unpaid labor. What has been, how long has the problem been ongoing? When did it start? If maybe we can put it in that context.
I think this employment issue started like 5 years ago. You see, earlier we had, I think I remember should be in my final year or something like that. It came in as something that we thought was going to be temporal. That it kept on going, And later on, we found ourselves in a situation where now doctors didn't want to just stay home. Like, you want to keep practicing. You need to perfect your art. So you're forced to do something. And the one thing that you can do is always go to hospital.
Sorry to cut you off, Dr. Chibwe, before you continue. So now, when you are in school, did it occur to you that when you start volunteering, it might be an automatic employment, or maybe vice versa, you're just volunteering for the sake of volunteering?
No, but we didn't think we're going to volunteer.
Okay.
That's the thing, we thought we're going to be employed. You see, and even the first court that had this issue, they thought, you know what, while I'm waiting for employment, let me volunteer. Then you find yourself 2 years, 3 years, 4 years, and what do you do now? Say something. Because no one would want to go to school. It's 7 years we're talking about. And now it's either you're on loan with government or you're paying your own fees. So you have your parents paying fees for 7 years. You graduate, you go back home, and then you're asking for transport to go to report for work. You see, and you have to get lunch. And remember, we're not like every other car, they go 8 and they knock off at 12. We work between 4 hour shifts. So meaning you have to provide lunch and supper for yourselves. Look at the risk now. There's the infectious risk. So if you get sick, who's going to pay your medical bills? It's the parents, because you're not on a scheme, you're not on payroll. So look at the medical legal issues. So if you are sued in your personal capacity, we have doctors who are in court with harassment, that they're defending themselves. You have to pay your own lawyer. How is that okay if you're not even on payroll? It's a lot. So to risk, and why you want to do that indefinitely, like that's not acceptable.
Okay, let's go back to the question. When did it start? The unpaid labor per se for doctors?
We have doctors who've been doing this for over 4 years.
Okay.
It's about 2021.
That's when the association was made?
No. We've been in existence for long years. But before that, this issue was not. You see, a long time ago, we didn't have a lot of medical schools. So you are doctors before you even finish your exams. A vehicle was waiting for you outside to be taken to a facility. Government approved medical schools. We now have like about 9 medical schools. So meaning the production is different from that what it used to be. So a long time ago, if you follow, the others would speak more on setting allowances and just focus on the question of service. But now the unemployment issue came in with a lot of schools now coming on board, and now we have more production. And this is the problem. Isn't that we have too many doctors? No. We have too many doctors on the streets and not too many doctors in the facilities. All these doctors, why now we have over 1,500 doctors? These doctors can man these facilities, and government can afford doing that, because, come on, we have other examples where we can cite to say the government can afford doing this, meaning government can afford employing doctors.
Dr. Chibwe, which brings me to my question. Are you consulted on an annual basis? You say there's doctors that have been volunteering for 4 years. When government is recruiting health personnel on a yearly basis in the last 2 years, are you consulted or informed about the number of doctors that will be absorbed year in, year out?
So
or are you aware of the numbers?
Yes. So the norm is when there's a pronouncement from PSMD of number of health workers to be employed. Associations are called on the table, right, to discuss the numbers, how you're going to break down. But these numbers are supposed to be within a treasury allocation.
Right.
Yes. From here, you're supposed to submit numbers. You agree to say nurses, you get this, doctors, you get this, and you submit those names. Apart from that, for us doctors, we like being part of how doctors are going to be employed. So we're going to go back to unemployed doctors, ask them what criteria do you want to be used for you to be employed, and we're going to submit that criteria. After that, then we're going to watch, because there are certain committees where we can't sit because we're not technocrats. Some committees you have to be part of the system for you to sit on those committees. So we're going to sit back and watch now. We have DHD specialists who will now take over the works. Later on, we have to look at now the final list, and see where we see issues, then we'll come out. So from the time I think I joined the association, I was treasurer, I was planner, treasurer, now president. We've had previous minister Masewu. We had 2 recruitments that had no issues. The current minister came in, which is the past recruitment. We sat on the committee and we proposed a number which is 400 something, right? And the criteria was we follow the database. This database, the rationale was, and this didn't come from the association, it came from our employee doctors. The rationale was, we're going to let people who've applied before to be employed. The ministry didn't have to call for new applications, because that was going to broaden the pool of applicants, right? Yes, and this was acceptable. It was an easy thing to do. So now when the final names came out, we had over 222 doctors who are not part of the applicants
Who found themselves on the list?
Yes. That's like more than 50% of the total number of doctors employed. And now you question, but how did this happen? Well, okay, there are also our doctors, but the thing is we need to respect the system. If we have a standard that we put in place, if you have your people voicing that you want to be employed, and then you go against that, then what's the motive? We went forward and registered this concern with ministry. There was no response. We went forward and reported the matter to ACC. ACC came out in the paper and spoke on this. We had because there was so much noise, public protector came to our office and we submitted the information, the evidence of the names and whatnot, and because there was a list. There was a list, the database, and we had a list of the new names, so you can tell the names were not in the database. So how did ministry get these names if you're not in part of the applicants? Was there a secret call for application that happened? And all this, there's never been a proper sit down where we get answers to these questions. And if I go back to my members, and they're asking these questions, and I'm seeking answers. I'm not getting answers. What do I do? Then we're stuck. Meaning there's no that cordial relation that is talking about in the media. We've had the cordial, engagement with other DZ. We don't know why they're doing this. So we don't know how cordial that engagement is.
This is Voice of the People. This morning we're talking to RDAZ, that is the Resident Doctors Association of Zambia, who are demanding for fair working conditions and urgent engagement from the authorities to resolve this critical issue. Our guest this morning is Dr. Paul Chibwe. If you do want to join us this morning, 0955-997-997 or
0979-192-485. Now, Dr. Chibwe, you did mention that actually the minister, Dr. Elijah Mchima, did put out a statement saying that he wanted to have a dialogue with you. Did you have it?
No. I wouldn't be here. I would have been in a meeting. No.
Nobody from the ministry has reached out to you?
No. Maybe they're yet to, but the thing is, it's on the out there. It doesn't speak to the agenda, because if there's an anticipated dialogue, then why is it still going public and still oppose the movement? Why do we have oppositions from the system, the people that are put in place in these facilities? This is contrary to what we would term as a dialogue. Because they would have been proper engagement to say, okay, let's hold on to whatever mechanism that we're using. They pause their media, we pause our media, and then sit down and then come out later on with answers. But there's a resistance on the other hand, and we'll continue as well.
Okay. What short-term impact do you think this withdrawal is going to have on patients as well as healthcare facilities?
Well, for the rest of our members who are employed, there's definitely there's burnout. We have there's a bit of hierarchy now with separation. So you have primary, you see the general residents, then there's the senior residents, and then you see registrars and chief consultant. Now, because we've taken away over 90% of the general residents, so now you have senior residents now dropping down to primary contact, and then you have also now these specialists now coming down. So we're ever now trying to cover up the gap that has been created. So you have a bit of modifications on the timetables. You have people now doing longer shifts in calls, and so these are things that we're experiencing. And the evidence is you can pass through this facility if you choose to, and that's why we have now the superintendent is manning these facilities to start now, out of desperation, to start calling these doctors personally to come back, issuing statements in these groups to say, if you don't come back, you never come back to these facilities. Otherwise, if it was nothing, they would have continued business as usual. We wouldn't have gotten the reason that we're getting now.
And you did earlier on mention that the Hero Stadium kind of arrangement was different and was contractual basis. Did you ever suggest that to the health ministry to say maybe if doctors were on contracts, not just volunteering, it would be a better route?
Is it for you to suggest something? You're supposed to have a table. You're supposed to give you a table to suggest. We haven't had that engagement.
You never wrote to them?
Well, there are letters that we've written starting from Ketch's call, from the time the minister is on office, and all those things. We have all those things, yes. But like I said, for you to bring something to the table, you have to be offered that table. Otherwise, if you're not offered, then how would you speak? How would you engage someone? So we haven't done that. Yes.
Dr. Chibwe, from the way you're speaking, I get a sense that there is disregard or a laissez-faire attitude from the powers that be with regards to the welfare of residing doctors and whatnot. Is that a fact?
That's a fact. That's a fact. And this is, if you follow most of these issues surrounding doctors. Right now we have the issue of TUTH, issue of car park. We have health workers paying to park at your own, place of, yes. So how do you go for work and still pay to park there? Wherever you go, you find there's employees car park, but it's different. This is the issue that made to the public, and before that, we engaged first of all management, we engaged our ministry as well to help, but there's been no response. We have issues to talk of setting allowances. You see, even that issue is just now it's become a myth to the doctors because no one is responding. So that's definitely that's a yes.
All right. Now, let's say for the sake of argument, your demands are met. Will there be a phase or partial return of volunteer doctors?
Well, for me, once we have that, we'll go back to these doctors. Yes, we'll go back to the guys. So those who are willing to, you go back, since we now have the way forward. We know how we're going to move. So these doctors will be amplified. Waking up to say, oh, let me use a 10 kwasa on a bus today because I know tomorrow I'm going to be employed, or because my friends now have been given positions. Next is me. You see, there should be that. But now you have doctors who are frustrated. 4 years you just go to the hospital, and the way it is, if you follow the comments on most of these platforms, public will say, well, we have doctors who volunteer. They didn't know that, because when you go there you can't differentiate how we work. The doctor volunteering and the look in the system, same work culture. You see, we work just to save lives. But now you have on the other hand public, when they see one of my doctors with dust shoes, our doctor and got for us, things like that. You see, and in these facilities we have a lot of harassment. You find these first levels that are in compounds. You tell a family to say, no, we're arranging some blood from the hospital. We don't have right now for them. You are selling blood. What are the problems? When you can get something that we don't have at the time, they will start harassing you. You see, but now going through all this, and you're not getting paid, and you don't even know when you're going to start getting paid. It's a very difficult situation.
One of the demands that you alluded to before you resume, volunteering your services, should the issue of the database, the names on the database, be resolved?
Well, at this point, I don't think what we're calling for is this not to ever happen again, because the doctors that were employed also are members, and they've reported these facilities. I think meaning that can be reversed. This can be reversed, but obviously, why you have over 50% of the abnormal to be normal, that's not acceptable. So I think this is one of the issues that we tabled even in our KT score. We were saying we don't want this to ever happen because this is not acceptable, and it paints a very bad picture with the system.
What if the ministry suggests that they can only employ a certain number of doctors to put them on the payroll? Are you going to accept that?
It depends on the number. So it depends on the number. You see, there should be employment is not supposed to be based on how much you feel can be allocated. It's supposed to be assessment. You do a ground assessment in these facilities so that you employ according to the need. So that if you look at the need and the allocation, they are parallel. We want the government to do the need assessment and employ according to the need, and then we'll be happy. But if you read the last night's post from the minister, he said they're employing 2,000 health workers.
Yes.
You see, 2,000. Like, this is for everyone. So in this we have nurses, you have clinic officers, you have drivers, you have porters, you have everyone. This number, and if you follow over 11,000, we get a 400 as doctors. Meaning from this 2,000, we get a 95 or 85. You see, that 85 is a deficit for a place. I don't know, a general hospital or just a department at UTH. It's not even close to the deficit that we were supposed to cover countrywide. So it will depend on the number that
who does the needs assessment? Again, are you consulted when there's a needs assessment being done?
No, there's a system. I think we happened to I think last year we started one of the reports. The reports were okay. They spoke to the facts on the ground, but now it comes to allocation. That's what the problem is. So meaning government is aware of what's needed, but they're choosing to allocate however they feel they can. Yeah. So in this, we have a lot of. It's a matter of priorities. Yes.
How many doctors do you think are volunteering according to your estimate? And how many do you think are unemployed currently?
Well, so the unemployed doctors, so this year we've had new graduations as well. So we've had, I think we're supposed to have over 1,500 unemployed doctors. This is not to actually include the recent graduation. Yes. And then now, if you look at the internship, that's a junior residence now. At every facility where you have like 9, we have 10 junior residents, you find about 8 not employed. You see, that's over 90% not employed. And then when you have now the entire facilities, you find now over 50% is manned by these doctors, and it's countrywide. It's just not in Lusaka. You go to Livingston, you go to Mansa, you go to Kasama, you have all these. As long as it's an internship center, you're going to find doctors volunteering.
Okay.
Yes.
All right. This is Voice of the People. You can be part of the conversation. The number is 0979192485 or 0955997997. All right. So moving forward, what specific demands is the RDAZ making to the authorities if you can just maybe coin it in a way?
Employ our doctors. Simple as that. And after that, let's continue engagement so that they don't have to come to this point of exchanging voices through the media. Yes, when we have a way of voicing out, like we don't even have to get to the media. If we get the response to say, no, doctors for now, wait, we don't have money, we'll sit down and engage later. But while we don't get any response, then we'll voice out the way we feel will be heard.
Do you think the channels that has been used for communications are the ones that are wrong, but if they reach out to you, you are ready to sit down with them?
Yes.
Okay.
But now we're responding to each other through media. Yes, so we'll continue doing that. The press statement, and then we see the way forward. And then the doctors, the volunteers, they're staying home. They're not losing anything. They are where they're supposed to be. Yeah, so they'll continue to be staying home.
I think the biggest loser is obviously the patients in these health facilities. My question was, do you think at the moment government has the capacity to absorb a good number of the resident doctors that are volunteering?
Yes, they do.
How do you know so? Because I'm assuming the issue that will come up is the budget has already been allocated, there is no resources.
And also the nurses would also want to be employed as well.
Okay. So you see, the day before yesterday, the minister was quoted to say there is no money. Yesterday, he corrected himself to say, I didn't say we don't have money, meaning they have money. He's on record saying, I didn't say we don't have money. So meaning there is money. It's a matter of allocation. And then the issue of nurses, we're not stopping anyone. If nurses are not happy, let them come out. Let them come out. But from what we're speaking for doctors, we make the diagnosis, then we're going to have a plan that everyone else has to follow. What the front, runners of the profession. We make the plan, and then so if these guys want to follow suit, let them follow. If they feel the numbers are not speaking to what they feel is going to reduce the burden, then let them come out. If they feel it's enough, let them be.
Okay. What working conditions and remuneration does the RDAZ consider fair and unfair? Let's start with the fair part.
The fair part is well worth. The general residence that is paid up. You're being paid and everything continues. And then for the after that, you have all these movements that we've had government saying doctors don't want to go to rural areas. That's contrary to what's on the ground. We don't want to move on unpaid positions. So I'm at UTH, I'm a junior resident, then I get promoted to go to FOSA, yet that position is not going to change the financial status. But how do I support myself? Apart from that, there's what we call setting allowances. The expense of you moving from, even that is not covered. We have almost all the doctors, very few have right now been paid setting allowances. So you want to move, yet they don't want to cover for that movement. If the doctors are being promoted, they move on a paid position. I don't think people would want to let me be in Lusaka and be a general resident. No. I want to be promoted, and if that promotion comes with the right pay, then we'll move. And if it covers everything else that's supposed to be covered, because we have documents to speak to these issues. It's not like doctors will just wake up one day and say, no, we are entitled to certain allowance. No, we have documents to speak to this. So we are just asking to be given what we deserve.
Why are some of these issues creeping up now when one would have thought that with the huge employment numbers that we've witnessed over the years, that the last thing we'll be talking about is the plight of doctors?
No. These issues are not coming out now. You see, there was you remember Dr. Branchota? Yes, he came out to speak on most of these issues, and then we're at now a period of I don't know where people didn't hear anything from her, but for me, why I'm coming out now, because I'm just a month in the office, and for me, I'm not choosing to keep quiet. I want to focus out on these issues, so that if there's a way we can handle these issues, we handle them.
So these are the issues that you found piling up?
Yes.
So your predecessors, none of them attempted, apart from you alluded to Dr. Samba.
Well, I wouldn't comment on that. It was a different tenure. Obviously, there were other fights, but we've had. I think the past tenure, we've had that issue where everyone else had increment in the pay, and then some junior residents. The resident doctors were denied that increment. Others that came forward and they fought for that, and later on were given the 10.5% that was given to everyone else. So we've been fighting. We've been fighting. Yes.
Now looking at the whole situation, don't you think it is demotivating rather, young youths that would want to go to that path and become doctors?
Yes, it is. It is, but the thing is, keeping quiet is worse. Because now these youth will be thinking, once I become a doctor, I'll just volunteer. No one is going to speak on the issues, and this is going to continue to be no. But if we voice out, I think there's meaning.
Okay, you got that thought. Hello, it's to the Power Breakfast.
Hello, good morning. You're to the Voice of the People. Hello, good morning. Good morning. Good morning, you're through the Voice of the People. Okay, we don't seem to have someone on the line there. Please go, carry on.
Yes, sir, at least if we continue voicing out some of these issues, meaning there will be that second thought, but there's a back of the mind they'll be thinking there's still some light at the end of the tunnel, yes. But while we go quiet, then that's worse.
Now, also talking about volunteering, you did say some it emanates from passion and some it's in the hopes of getting employed. Again, what is the way forward with volunteering? Do you think it needs to stop, or do you think it needs to be keep on going as a way of maybe medical practitioners gaining experience as well in that form?
Yeah, so I never said some of them it's with the hopes of getting employed. Because as an association, we've been very categorical on the issue of volunteering. That's not a criteria for employment. Meaning our doctors know that. So we have a good number doing this because they want to get through internship. So they're now for registration, and they can apply for employment in Botswana, in Namibia, or they can just choose to go in NGOs and whatnot. Because minus full registration, straight from school, you're limited. You're confined to move to a system where you do provisional registration and licensing, and then after that, then you get full registration.
Hello, you're to the Power Breakfast. Good morning. Okay, we might have a technical challenge there. You might continue with your...
Yes, so most of them are doing because they want to progress, so they can have that frustration and seek opportunities outside the system. And then you have a few doctors that don't want to just sit at home. They want to forget the arts. They want to sharpen their arts, so they continue going to these facilities. Then others, you have, of course, they want to just help out and champion the primary health care that and the universal health coverage that the ministry is trying to champion as well. So I don't think we've never the criteria that spoke to a doctor volunteering and getting priority. No. We've never, if there is that, meaning it's other cadres in the health sector, but for doctors, that has never been the criteria for employment.
Dr. Chibwe, as we wind up, what happens next if the authorities at the Ministry of Health and others don't respond to you within a certain timeline? What actions is DAZ looking at taking?
Well, let me go on record to say, even this mechanism didn't come as RDZ imposing this on unemployed doctors. No, this came as an outburst from the unemployed doctors. They were exploring other ventures, other ways of voicing our issues, and as leadership, we guided to say, let's do this, because this is within not doing any harm to anyone. We're just going back to where we're supposed to be.
Right.
So at this point, I'll continue going to hospital seeing patients because I'm in the system. I'll tell my unemployed doctors to continue being home, and then we will group to say, then what's next, and then we'll decide the way forward.
When are you looking at that time when you would decide?
Oh, I think we should have, because there's the anticipated meeting that is not going on, and the last night's post spoke contrary to what we're expecting, and this is a call for another meeting with within ourselves, and now try to speak over what's happening and to see people forward of how we're going to move.
Dr. Chibwe, it's been a pleasure having you in the studio. We certainly do hope that this issue is resolved promptly.
Thank you for the invitation.
In case you're just joining us, we've been speaking to the Resident Doctors Association of Zambia President Dr. Paul Chibwe, who recently announced to the association that all volunteer resident doctors will withdraw their services from public hospitals starting yesterday. This action responds to the ongoing issue of unpaid medical labor, with over 50% of public hospitals relying on unemployed resident doctors to provide essential services without compensation. Dr. Chibwe, once again, many thanks indeed.
Thank you, Patrick.
This has been Voice of the People. My name is Patrick Chibwe, joining the Queens of Breakfast this morning, and of course the Power Breakfast continues momentarily.
Voice of the People is a dynamic and interactive radio phone-in show that gives listeners a platform to voice their opinions on current affairs, social issues, and community concerns, with engaging discussions, expert insights, real-time audience participation. Voice of the Takeover.